hit this. Okay. All right. Hello, everybody. Thanks for joining. I'm just going to kind of pause for a little bit at the beginning here. Looks like we already got a good amount of people on this call, so thank you. Thanks for joining. This is a little informal Q&A session talking about facelifts, neck lifts. And it's a topic that I love to talk about, and I do quite a bit of these surgeries and these consults. So, but it can be really intimidating to people, and I think this works really well. This type of informality, because there's a lot of information out there, and there's a lot of questions, and people. It's just hard to find like honest, like succinct answers to some of these ideas, and it can be, like I said, really intimidating. So this will be fun to kind of work through some of this stuff. We're just getting more people coming on now, but I'm gonna work through a few slides that I put together, just talking about concepts that I think are important at the beginning, just some really like high yield bullet point ideas that I would want every patient to know about these topics. And then at the end, we'll open it up and you guys can fire any questions in the chat on the right side of my screen. It probably looks the same on your screen, but just drop any questions there and I'll hit them as we go. So yeah, thanks again. And let's see, let's advance. So yeah, my name is Jake Thayer. I'm a board certified plastic surgeon. I specialize in aesthetic work on the face, breast, and body. I do a lot of facelifting. I love this type of surgery. It's really fun. It's really, when done well, I think it's a really delicate, refined, pretty result. And it's a really fun one to help people like see this in themselves. And it's fun to be a part of these transformations. So let's just get into it. So facelifting, what is it? As well as neck lifting, and what's the goal? So this is a little pictorial. The whole goal of a facelift is not to look different; it's to look like you, but better. So I don't want to, the goal is to reposition facial tissues and volumes back to where they used to be. So we use this SMAS layer that's hot bolded here, SMAS. That is a tissue layer on the face that is the best to reposition volumes back up onto the cheekbone. So the volumes start at kind of in the mid-face and then descend down with time. Similarly, that happens at the jaw, along the jawline. And so the goal is to take this SMAS layer, naturally reposition that up back where it used to be. And that improves your the cheek area, the nasolabial fold, marionette line area, jawline, and neck. And so it's a newer modern technique is to do what's called a deep plane lift and use this SMAS layer to reposition the tissues. Old school facelifting decades ago was based on using just skin and tightening that skin and pulling on skin, and that can make people look fake. And it makes the skin look tight. It makes it look unnatural. So this is definitely the way to go. And the goal is to basically, like I said, make you look natural, make you look like yourself, just rejuvenated, basically. Types of facelifts. This is a huge question that I get asked all the time, and it's really confusing, even to people within medicine, or even plastic surgeons who don't do these types of surgeries. There's a whole lot of different names and terms and phrases for these different types of lifts that can be confusing to people. And a lot of it's just semantics. Like it's a lot of the same techniques, just labeled different things. So I drew on this picture on the right to try to like clarify this a little bit. But a deep plane face and neck lift is kind of the gold standard rejuvenation procedure that addresses all areas of the face. So that is the most work being done in that surgery. That's going to address, as you see there in that, all of these colors on the highlighted photo here. It's going to address the mid-face, address the nasolabial fold, the lower jawline, as well as the neck. So it treats all these areas in combination. It looks very natural. And when you're resuspending all of these tissues back up in one cohesive manner, it's done well. But to contrast this surgery with a mini facelift or a lower facelift or even a neck lift, the less a little bit short of a procedure, less work would be called a mini facelift, also known as a lower facelift. And that is more so focusing on the jawline and the jowl and this marionette line area, as well as the neck. To even dropping down another layer, which would be the neck lift, which is going to treat basically the neck area only. That's a little less common in my practice, in that sometimes isolated neck lifts are typically a younger patient who has a full neck with a little less skin laxity. But in my practice, I feel that people come in and we talk about their neck, they dislike their neck, but also if I'm only focusing on a neck lift, we also talk about the jawline and how will the jowl look after the neck is tight. And so I always want a natural look that blends well with the rest of the face. And so sometimes I extend the incision a little bit. We discuss this in the consult to not work on one area, tighten the neck up, and then all of a sudden have the patient be bothered by a little bit of a jowl later. So I want it all to blend well and look well. All these terms, a lot of different surgeons kind of basically coin unique terms, create names for different lifts. And there's some blend of all of these different terms together. But this is the way that I look at it as far as like the most invasive, but still very delicate, is that deep plane face and neck lift. And that's going to treat all the layers of the face, all the areas. Mini and lower facelift, mostly focusing on the lower jaw and neck, and then the neck lift would just be the neck only. So incision options, another big question, a big important point for patients to think about is how do we do these surgeries? What kind of incisions do we use, and what's going to be left after the surgery that's visible? So this is my patient. I saw her back this week in my office. She's 3 months out after surgery, and in the next slides, I'm going to really zoom in on her incision so that you can see like right up close what that actually looks like. But all of these incisions are more or less in the same area. They're all hidden in these natural borders of that hide between the ear and the face skin, or like the natural hairline border of this temporal tuft, as it's called, as well as behind the ear and along the hairline. So these incisions are intentionally placed this way. They're designed in these locations because that's best to hide an incision, is to put it in a delineation of a structure. So put it where the ear ends and where the face starts, and then hide it along the hairline and the temporal tuft, so that the hair will kind of peek over and grow over that incision as to conceal it. She's 3 months out. Scars take a full year to fade, but she already looks really, really great. And let's zoom in on some of these areas. So even at the 1 year mark, these will be even more faded. So they'll be like closer to normal skin color. We have lots of tricks up our sleeves that we can do. We can treat these scars with lasers or steroids if needed, but oftentimes just a well-designed tension-free facelift like this will lead to this type of really nice scar. And you can see on the top left photo, I'm pulling that hair up with my finger. You can see that's that incision that's wrapping around the temporal tuft. And then the incision kind of continues down along the ear, goes behind the tragus of the ear, and then around the lobe, and then behind along that hairline. So I'll hit on incisions a little bit later also, but really less perceptible than a lot of the average patient thinks are these incisions. They hide really, really well, even with patients with short hair, which I'll show you some examples of later, but that's kind of what we're looking for. The deep plane face and neck lift does extend the incisions a little bit, like it's similar to this patient that wraps up into the temporal hair. And all of these different versions of facelifts utilize the same incision. The question is, or the variable is just how long of an incision we need. So what to expect. And go ahead and if you guys have questions, feel free to fire them off. I'm trying to be sensitive to everybody's time here, but so I have just a few more slides and then we'll kind of get into some questions. But what to expect? Let's demystify this process and talk about what does this actually look like for you in your life. A lot of times they're bothered by their face, their neck, but they also don't want to take a ton of time off, or they have busy lives, they have family, they have trips coming up. So this surgery, a lot of my patients are surprised as to how this does. Like the recovery is pretty quick. This can fit into your life easier than you would think. So how long is surgery? Typically ranges 2 to 4 hours, sometimes a little bit longer if we're going to do more procedures during that surgery, like eyelid surgery or brow lift, for example. We do them all outpatient. So my patients go home the same day you're back in your house recovering in your comfortable own living room. I don't use drains at this point in my practice. Instead, I use what's something called the hemostatic net suture, which is just a fancy suture that's taken out about 4 days later, which is really nice. This is another patient I saw back this week in my office. She's 1 week post-op. You can already see pretty dramatic change in her neckline, her jawline, neckline, and a little bit of bruising, but not as much as like some people think you're going to be like really bruised, really swollen, and everybody varies. However, you'd be surprised, even at that 1 to 2 week mark, people are out doing light errands, they're seeing people, and you're not going to turn heads. It's not this like, you don't have to hide away for a month before you go back into public. And she looks like her, she just looks better. And then pain. So the pain is pretty minimal, pretty mild pain. Typically people feel tight. It's not typically a ton of pain. Things just feel tight and swollen. And my patients typically take narcotics for about a day or two. I do have my patients wear a neck wrap after surgery for about a week. It goes under the chin and then goes over the head. And then I have them wear it at nighttime for a second during that second week. So not a whole lot of like care or maintenance is needed. And how does recovery look like? So for that first week, you're a little bit of bruising, a little bit of swelling. That starts to fade. At the 2 week mark, people are returning back to light social activities. Typically, my patients are returning to work at that 1.5 to 2 week mark. If you work from home, you can be working the next day after surgery, as soon as you're off of pain medication. And then at that 2 week mark is when I let my patients start light cardio. So that means walking, basically, walking for exercise. At the 4 week mark, you start to increase your activities, do more weightlifting, increase your exercise. And then, after that, it's just listen to your body, listen to your swelling, and kind of I let people do whatever it is that they were doing activity wise, nearing that kind of 3-month mark. Risks and safety. So this is surgery at the end of the day. The risks and the risks are very, very rare, and there's complications. This is, it is surgery. However, incredibly rare complications. However, bleeding, infection, some areas of numbness on the skin or asymmetry. So I always have all my patients aware of this. It's important to know this. I talk about this at every consult because it's surgery. However, done well and done in the right hands, I feel like we really try to keep this as close to zero as we can. To that point, I think I'll kind of touch on this a little bit in a second as well, but a lot of people want to know, what can I do to start or like rejuvenate? Like, what can I do to get me the results that I want? There's a lot of non-surgical things we'll talk about. But at the same time, I think there's a misnomer. People think that doing some of the non-surgical things is going to lead to a little bit more of a natural result. However, I challenge that idea. And if you go to surgery and do some version of a lifting procedure like this, it's way easier to get more of a delicate, elegant result compared to just utilizing fillers, for example, and just trying to fill the tissue, fill volume to try to lift things. So done well, it's almost like you need to do sometimes be a little bit more aggressive on the treatment plan with surgery to get more of a natural result. Okay, so some befores and afters let's look at. So this is a patient. She had a mini face and neck lift done, beautiful bone structure to start with. And so my job is just to reveal that and help her look the same way she, look like her, just better. So she's 3 months out in these photos. You can see kind of from the front on view, the squaring, the jowls, the nasolabial folds, the marionette lines are all improved. That quarter view is really nice to look at her neck and what that looked like, a little bit of crepey skin beneath the neck. And that's all just brought up and natural, pretty, just looks like her, but better. This different patient, little similar operation, another lifting procedure. So from that front on, same things that I call attention to, that jowls, the folds in the midface, the tissues kind of descending. And then afterwards, volume is just repositioned in a nicer location. Excuse me. Neckline's looking great. I show the same patient from a side view to talk about incisions. So incisions are typically really well hidden with hair. And even so, if any patient's going to be apprehensive to the incision idea, it's somebody with short hair like this. So she, and if you could screenshot this and zoom in on that photo, it would even be easier to see. But that same scar placement, but even extending behind the ear there in the hairline, even in short hair patients, these scars can hide really, really well, and be not noticeable. So deep plane face and neck lift on this patient, treating like the mid face, the nasolabial fold area. Skin looks smoother, jawline is clean, and neck looks great. I also did a subtle brow lift on her at the same time, just to help soften the brow position, not to raise them too high. Really, the goal is to make her look good, not different. Yeah, she's doing great. Male patient, lower, basically a mini face with a neck lift. Males also, I have male patients. The goal is to not feminize, but to make you look better. He did not like the way he looked. He told me that his in photos from an oblique angle and from the side, when he looked down, he reminded himself of his dad. So the goal was to make him look like himself. Just roll the clock back. I think it looked a natural result. Jawline's cleaned up, and he's happy. Different patient, mini face and neck lift. A little bit younger patient, typically. So a mini operation or a lower face and neck lift operation, just not to generalize. Typically, patients in their 40s, 50s. And this patient falls into that category. Deep plane face and neck lift, a little bit more commonly, patients in their 50s, 60s, 70s, typically is what's needed. She, as you can see, her neckline from that front view is very smooth. Jawline looks great. Also did an upper eyelid lift just to make her eyes pop and just to open the eyes a little bit. But natural, looks like her. Okay, so looking at the time there. So these are some questions that a lot of my patients bring up in consults, and I'll hit on a few of these, and then we'll open it up here in just a second as well. But how do people know if they're ready for a facelift, or if it's too early, or if they're a good candidate for it? Really kind of depends on the patient. How do you feel about yourself? Do you find yourself, how often is this impacting your day-to-day life? How often do you find yourself in the mirror looking at your jawline or your neck, or thinking about this? If it's frequent, if it's a lot, then then you're probably time. It's probably time. It's not like there's not an age number. The trend is becoming to do these operations younger, on younger patients, make them more natural so that you age gracefully, and not wait until later in life and then do a big heroic operation and try to make you look different. So the goal is to just age gracefully, smaller tweaks. But if you go in the mirror and you can pull up on your jawline or your face and you like that look, that is a good sign that you'd be a good candidate for this surgery. Can doing it too young make it harder to age naturally later? No. You'll continue to age gracefully. Gravity always continues to work on everybody. And you just, like we said, roll the clock back, and you continue to age the otherwise, like in the same way as you would have otherwise. What's the SMAS layer that everybody talks about? Kind of hit on that a second ago. That's that supportive layer that's really important to use to do the deep plane technique to reposition the tissues. And do we shave the hairline or pull the skin tight? No to both of those. I'm not shaving any hairline, and the actual skin is not pulled tight. It's the deeper layers that are, and the skin there's actually very little tension on the skin itself, which makes for those really pretty scars, because when there's tension on the scar, that's when those scars can widen. So the goal is to actually not put a ton of tension on the skin, but actually the deeper layer. Can fillers and threads delay the need for a facelift or just mask it? Yes, I would say that fillers. The threads used to be a commonly done thing. They're a dissolvable suture that helps minimally invasive pull tissues back up, but they don't. We've kind of found that they don't last very long. They dissolve. It's not a good long-term result. So that has kind of fallen out of favor. I would recommend against personally. Fillers are great for selected uses. Great to fill in areas that you are actually volume deficient. So sometimes along the cheek, some subtle filler is really nice, or chin, lips, it can be nice done conservatively. However, I would caution anybody about using filler to lift tissues or using fillers for the purposes of lifting, because it's, in my opinion, not a great use of filler. It should be used for a very specialized reason. Non-surgical alternatives. A lot of questions about this all the time. Like, what are my other options? I'm not ready for a facelift. I don't want to think about that, but what else can I do? So lasers are an awesome thing that everybody should be thinking about. It's just good skin maintenance. Just like other organ systems, you have to take care of all of your body, our bodies as we age. Skin is no different. And so lasers is helpful to maintain your skin. And that can come in the form of broadband light lasers, which just take pigmentation out, halo resurfacing lasers, or even deeper lasers, erbium lasers that I do personally. Those are all work together to keep your skin looking really, really nice and as you age, and just a graceful addition to any of this. And I think I'd recommend everybody to be thinking about lasers no matter what. Good skincare, same idea. Taking care of your skin, really, really important. And that includes sunscreens and retinol creams and and good moisturizers. Botox is an amazing adjunct, softens lines. It's not to look frozen. It's not to look fake. It's just to soften lines and make you look more natural. Kind of hit on filler a second ago, but filler versus fat transfer, it's good to put volume back in areas that you have lost it. Everybody loses volume as we age in our face. So filler is a temporary way to do that. Fat transfer is a little bit more permanent. There's a permanent way. I borrow fat from other areas and then add it. Typically in the nasolabial areas, it's very nice, and kind of in the mid face, as we lose the volumes, start up at the cheekbone, and then as we age, they fall south. So adding a little bit of natural volume is nice. And then cost. A lot of my patients ask about cost. It's a big idea. And if you guys feel free to DM me on Instagram or email us. We'll have some contact links here, and just at the next slide, I'm happy to review photos of you and give you just a good idea of like what costs could look like. Or if you want like specific ranges, I'm happy to like speak about that openly too. It's everything can vary based upon how much surgery is needed, essentially, technique wise. And every patient's different, but mini facelifts are a little bit more inexpensive. Full facelifts, just a little bit more expensive, but happy to talk about that as well if there's any interest in the chat in a second here. Lost my light there, Kira, but it's all good. Sorry, my face is more dim now. So here's some contact info. You guys can reach me on my Instagram directly. Feel free to directly message me, send me photos, or our website or email, or this is our phone number as well. Also, thanks for tuning in. I really appreciate you guys. I know everyone's life is super busy. We do have a raffle as a thank you for being on here, and some really nice skincare products, and also a complimentary broadband light laser treatment that I was kind of talking about a second ago. Really amazing for taking pigmentation spots off. So stay tuned. We're going to announce that tonight at 6 p.m. on Instagram and Facebook. So stay tuned. So thanks for being here. Thank you. Of course, thank you so much for being here. Okay, so I'm going to remove that or get out of this slide. Okay. So yeah, feel free to, we have, I can keep jabbering here if I want, but if you guys feel free to answer any questions in that box. Oh, here's one right here. Okay, so the question is that I left on 15 years ago when I had skin cancer removed. Eyelids are a bit saggy now. Will an eyebrow lift help reduce that sagging? So great question. It depends on if it's your lower or your upper eyelid, and yes. So brow lifts, anytime we talk about eyelids or eyes in general, you have to think about three different things. So one is your actual brow itself, the position of that. One is the extra skin on your eyelid, so upper eyelid skin, and then the third is your lower eyelid skin and volume. So if you had, let's see, so you can share if it's your upper answer, if it was your upper or lower. I can speak more specifically, but brow position is important to think about. If your brows are low and it will push the skin down into your eye, then that sometimes just doing a conservative brow lift helps open the eye up. And was upper eyelid. Awesome, thanks. So yes, definitely. So sometimes just go in the mirror, and you can send me photos as well, but pulling up on your brow or raising that up can open your eye as well, to help open it up and kind of rejuvenate it. But sometimes if in addition, it's an extra skin issue, which is a upper eyelid lift, that can also kind of help correct that. Lower eyelids is that third thing that we talk about, and that's kind of a different topic. But yes, and like a brow lift, potentially if your brows are low, a brow lift could be a way to improve that. Or you may alternatively maybe an upper eyelid lift to treat the skin, or both. Question is cost. Yeah. Let's talk about that. So yeah, and we feel free to shoot me a message, Lori. Mini face. So I'll just give a broad range. Mini face and neck lifts typically are around $15,000. Deep plane face and neck lift typically is in the range of $20,000. Every patient's different. It's all dependent upon how much time and work is required for the actual surgery itself. But there's some more questions more questions in the questions tab. Am I missing that, Kara?
Yeah, the next one. was where should someone
Okay.
send a photo to get an idea of what
Oh,
you suggest?
perfect.
What else will cost?
Let's do, so if you guys are on Instagram, you can search for my name, Dr. Jake there, and you can just direct message me that way, or you can use our email. And which I put in the chat at the very top. You can shoot me an email at info@myquintessa.com with a few photos, and we'll review them and get back to you. Thanks. Could you address under eye darkness and hollows? I had filler, which did not work. Yes. So the lower eyelid area, darkness and hollows. Yeah, let's talk about it. So things to think about with the lower eyelids. Filler can be a little challenging, can be tricky. It's nice when it works great, but it can be challenging. So filler is placed in the trough, the tear trough, this depression, to try to fill in that area, to try to blend the lower eyelid bags from your face. But the actual darkness of lower eyelids can be a little bit trickier and a harder issue to fix. That darkness is the muscle layer that you're seeing through the skin. So that's likely you have very thin skin and you're seeing this orbicularis muscle beneath that. So oftentimes caffeine creams and good skincare can help. Lasers can also help treat that darkness. There's not just a one solution answer for the darkness itself. The hollows, a little bit easier fix for that. The hollows, that tear trough is typically best treated with surgery or filler. Like you mentioned, you already tried filler, but surgery, a lower eyelid lift, in part of that operation, we release the ligament that pins the skin down and creates that trough here. And then also sometimes it's nice to add a little bit of fat transfer to kind of fill in some of that volume permanently. And if you have lower eyelid bags, that creates the fullness beneath the lower eyelid. That is treated by removing a small amount of fat. So there's like 3 different moves that happen with a lower eyelid that you should be thinking about. And so a consult's really kind of nice to talk about the lower eyelids because it is a little bit more in depth. What can you do for marionette lines? So marionette lines are these ones on the corner of your mouth that everybody gets. You could do a few things. So starting from least to most invasive marionette lines, you could try resurfacing lasers. You could do some lasers to help improve. If they're fine lines and small lines, halo lasers are a great place to start. If they're more deep set, deeper lines that have been there for longer, then you could try more aggressive laser like an erbium laser. But a face and neck lift is actually the best gold standard, in my opinion, way to treat those lines. If it's created from jowling that you notice here, and if you pull up on your lower face in the mirror and that improves those lines or removes them, then that's a good sign that a facelift is going to be your best treatment for that, or some combination. It's a lifting procedure with a laser to help kind of smooth out and resurface the lines. Let's see. Let's say 53. My face is 53 years old and not bad. Think basic face and jowls and nasolabial folds. So just going purely based on that information, mostly likely a lower facelift and neck lift is going to be your best bet there, Lori. It's going to really target the lower face here, and the jawline and all of that gets really targeted, as well as the neck. If the nasolabial folds, the nasolabial folds are what's going to be treated, and that mid face is what's going to be treated with the full deep plane facelift neck lift. That's going to be most likely what we'll be talking about. Great question. So are these procedures done in the office, or do they need general anesthesia? So in my hands, in my practice, I do these all under general anesthesia. I feel like, and so you go, it's super, super safe. General anesthesia is safer than driving on the highway in a car. And you are not going to wake up during the middle of it. You're not going to flinch. You're not going to, it's very meticulous work. I'm constantly thinking about which plane I'm in and where are the nerves in your face. So I don't want anybody moving, and I don't want you to feel anything that I'm doing. So I do all of these variations under general anesthesia. The caveats there would be upper eyelid surgery I do in the office under local. That one's great. As well as some facial liposuction under the chin liposuction, do under that in local in the office. But the rest of it under general anesthesia for those reasons. I don't want somebody flinching, moving, or feeling it. And it's so meticulous that I want to be really incredibly precise with what is being done. How much do consults cost? So I don't have a set. We just have a small fee of $100 to hold your space. That fee just gets rolled over into the cost of surgery later. And yeah. Do you use a local anesthesia or are you out? So yep, kind of similar idea. It's general anesthesia, you are out. But I do use local in addition to that to help reduce the pain when you wake up and make it more comfortable. Next one, is there a particular reason why some surgeons choose to place incisions in front of the ear rather than less visible areas? So yeah, good question. So sometimes people try. So I typically bring my incisions, like many people do, and for some of these bigger lifts, in front of the ear in that location that I showed. That helps to redrape the skin. Sometimes some surgeons will try to do everything from behind the ear in a really like minimally invasive, minimal lifting, or minimally visible technique. That means all of this tissue is done through an incision behind the ear. But in my hands, that bunches, all of this tissue gets moved backwards then. And if I'm doing all that through that incision behind the ear, then it can create bunching and pushing up in front of the ear right here. And so I don't like that bulkiness. I want everything to like lay flat. And I personally feel like by bringing that incision around the front of the ear, it's still really well hidden, and that allows the tissues to redrape better, which makes for a less conspicuous result, like a better result essentially. So that's why some people try to hide the incisions behind the ear only, or do like a minimally invasive endoscopic technique. That's like we're using little incisions in the hairline. Another technique to try to just pull things up, and then they let the skin kind of redrape and settle out with time. But I personally feel like I want that skin to lay flat, look really pretty, and a well-placed incision when the skin is laying flat and there's not any lumps or bumps or odd things that have to smooth out. I think that gets a better result long term. How long after consult can I have my surgery ballpark? Great question. My coordinator Maggie is amazing. She's super helpful. She works the schedule and she helps me with the schedule. We book out a few months in advance, but if you typically 2 or 3 months, but she's happy to kind of work with every patient. If you have a specific date in mind or a time or an event coming up, feel free to like direct message me or shoot us an email. We'll work with your dates to try to make it easy for you. What's the difference between a D-plane facelift and non-D-plane? Great question. So really good question. So a D-plane facelift and a non-D-plane. That means what plane am I using to reposition the tissues back up on the face? So the D-plane is beneath that SMAS layer, that really important layer. A non-D-plane that could fall into a variety of categories. Historically, there's some people just do a skin-only facelift, which means you're just under the skin and you tighten that skin up and you suture it. And it looks great, but the long-term longevity of that result is not as good because it's all the tension is being pulled on that skin. It makes the wider scars and a recurrent result. Like your results don't, or they recur faster. So that would be a skin-only facelift. Another technique is called like a SMAS flap, high or low SMAS flap technique. Just similar result, but just more dissection. You're beneath the SMAS plane, and then you're also dissecting beneath the skin. It's just more dissection and more in my hands and in my opinion. Every surgeon has a different opinion on this. I think more risk of issues long term. That being said, every surgeon has different takes on this. D-plane facelifts are really hot right now. Everyone's talking about them. I agree with that in that it's a great technique and the longest lasting. But there are a lot of people still doing other variations on the theme. One of my hesitations that I've been told that most people who will still need volume. I prefer not to use filler. Will my face look sunken? Great point. I love doing fat transfer with facelifts. I did 2 surgeries this week with that same exact technique. So I think fat transfer, so to your point about still needing volume, the majority of people lose volume as they age, and that can look a little more masculine. It can have an aged look as you lose volume, particularly in the temples, in the cheeks, and in the cheekbones, kind of in the lower face as well. So you could run the risk if you have a lower BMI or a thinner patient, have a thinner face, then that is a risk. Yeah, if with the lift itself, with a well done deep plane lift will give you a little bit of fullness in the cheekbone, which is really nice. However, adding fat transfer is also super nice, and that makes it look natural. It's a very natural volume. It's soft. I borrow that fat from your belly or your thighs. And then with that fat comes stem cells, which makes the skin look really, really nice and softens the skin. So those fat transfer with face and neck lifts is a really nice 1-2 combination for a natural, pretty result. I also will thin that fat down really, really thin and put some under the lower eyelid area. And that is mostly just bringing stem cells to help rejuvenate the skin and look really nice. It looks really bright. The skin looks great after.
There's some questions on the tab questions. If you wanted to go over there, check them
Yeah,
out.
where's that at?
Go over there, right there.
Questions.
Mhm.
Awesome. Thanks.
Yeah.
Okie doke. Yeah. Sorry, I feel I'm being a little bit long-winded with some of these. I'll try to give you quicker answers here on some of these. Crepey type skin chin area. Will this be softened with the lift? Can I shower or swim afterwards? Crepey type skin around the chin. Yes, that is oftentimes improved with the lift. Do this move at home. If you pull up on the skin, that really smooths that skin out typically. There's a lot of other things that we can add to that for crepey skin. So the lasers, fat transfer can help bring some volume back to this area. Retinol cream's great for skin crepiness. Can I shower or swim afterwards? Time frame? Yes. So I let all my patients shower post-op day 1. So the day after surgery, I want soap and water getting on the incisions. I like that it keeps them clean, makes you feel better. So yes, you're showering right the day after. Swimming, a little different. There's odd bacteria in water sources. So typically I have my patients 4 to 6 weeks before they're swimming and submerging the incisions, that is. So chin lift only put on at night or always that first week. So public it is required. Can you do halos? Yes. So that the support band is typically, I would have you wear it for a week. You could take it off for like an hour or two if you need to go out that first week. But I typically like it on pretty much continuously. Can you do halos afterwards? Yes, I do. I can combine lasers with the facelift. I typically will do a deeper erbium type resurfacing laser at the same time, but you could get a halo laser as soon as a month after if you wanted in our practice, or I could do that deeper laser at the same time. Question was, do I offer IV sedation instead of general anesthesia? I don't currently. So in my practice, I typically like that general anesthesia. I like the fact that you're not going to wake up, that you're not going to move. And I feel it's very, very safe and done well in our practice. So that's what I do. Currently, I'm not offering IV sedation. Is it better to do a facelift earlier than later? Is there a better result? So great question. The timing of a facelift, I don't think there's a better answer. There's just patient and surgeon preference. If you're bothered by, I like doing facelifts a little bit earlier in people's lives. I do a lot of facelifts in people's 40s and 50s. I think you get really nice natural results. I think the skin is excellent at this point. Still a lot of collagen in the tissues. It really redrapes and looks natural, and you can get a really natural result. And so, and then also, the alternative is to delay until you're 70 years old or 60 years old until it really bothers you, and then get the facelift, which is still a lot of my patients are still in that age range as well. But it's if it bothers you at this point in your life, in your 40s, then I don't see a reason to wait 20 years to then do it later. That could have been 20 years that you could have been enjoying your result, and especially when they look so natural earlier in time or earlier on. Oh, thanks. Already answered that one. And let's see. Does use of Sculptra make it more difficult to do a facelift? Good question. So this in facial injectables, does it make it harder to do surgery? I can see. So Sculptra is a little bit different. It's a little bit more subtle than like a structural filler. So I personally feel like Sculptra wouldn't change things all that much. Sculptra is a little bit less structural, whereas filler is thick, and you can actually see filler in someone's face during a facelift. And so if there's a lot of it or it was recently put in, so sometimes I have my patients dissolve that filler before we do surgery. But Sculptra, I don't anticipate like a big change in the surgical technique one way or another on that. Oh, let's see. I'm going to jump back over here. Okay, so where do surgeries take place? Surgery. So we do all of our surgery in Brookfield in our own surgery center. It's a really, really nice place. I love it. We have our own staff and they're handpicked. They're top notch. It's not done in a hospital. You're not around sick patients, but it is an incredibly safe surgery center, the highest credentialed surgery center called Quad ASF certification. So it's incredibly safe. But it's a very white glove experience that you come and go home the same day. You have your own private like waiting area. It's really, really nice. You are able to, everybody goes home the same day typically. Some of my patients come from further away and they want to stay over in a hotel either the night before surgery or like one night after, just to kind of recover with a loved one. That's always a good option, and we can help you through that process as well. Trying to like help with scheduling and such. Okay, the next question. Had a mini facelift, blepharoplasty, lateral brow lift, and a neck lift. Not happy with the marionette line results. Was told to use filler. Surgery was done, so you do not need fillers. I do not like fillers. What can I do now? So that's kind of a tough one. Without looking at photos and evaluating you, it's hard to kind of weigh in just exactly as to what I think would be the best answer there. So you feel free to send me photos or like even like a video, or come in and we can look at it in person. Depends on what the issue is. If it's missing volume in the marionette area, we could like if you're not interested in, you say you're not interested in fillers, fat transfer is always an option. If it's more of a crepey skin, or then you could try lasering that area, halo or erbium lasers. If we already kind of talked about treating the volume, you could try the retinol creams and good skincare. You could also, if it might be a tension issue, it might be you might need to retension that area through basically a revision lift that may be needed, but hard to say without looking at it directly. How painful is erbium compared to halo? Those are the lasers. I would say it's definitely more. It's definitely more painful. Halo is a great middle of the road resurfacing laser to start with for patients with less deep wrinkles. Sometimes people have really deep lines around their mouth from smoking or using straws, or just genetics. That's going to be better treated with an erbium laser, just to really heal, take those wrinkles down and let your skin heal back. However, halo also has a swelling, a few days of swelling, but pretty well tolerated. The erbium laser looks more like 5 days of healing, like your skin has to actually reheal, and then you can have areas of pinkness for about a month or two, commonly, that hides well with makeup. But erbium is totally basically taking the skin down to new skin that has to heal, whereas halo is looking like 3 to 4 days of swelling, and then you're looking better pretty quickly there.
And then I think this should just be the last question.
Awesome, thanks. So we're coming up on our time here. Thank you guys so much for tuning in. It's fun to talk about this stuff. I love it. This is like one of my passions. And yeah, feel free to shoot me questions or reach out. I'm happy to talk more. And we'll wrap it up here in a second. But is there a recording available of this session? Or will there be another one offered? That's a great question. Should we?
Yes, I put in the chat, but everyone should be getting emailed a recording of this session. If not, it will be posted on our YouTube channel.
Awesome. Thank you, Kara. I'm wearing aligners now to correct teeth. Should I wait until this process is complete? Yes, absolutely. I would wait. If you're correcting your teeth position, I would wait until you're done with that to see what the final like bony anatomy is going to be, because that will affect where your chin position is how your chin looks, and then also affect how your like facial tissues drape off of your like chin and jaw. So I totally would think that waiting for your teeth to be in their final spot is what you should do. And you're so very welcome. Thanks, Cassie. Yeah, thanks guys for tuning in. This was fun. And reach out. I'm looking forward to meeting you guys at some point in the future, hopefully, and have a great weekend. Should I end it?
Yep.
Awesome. Thanks.